We've just finished our first consultant combined staffed conference across the 3 acutes. 70 consultants turned up today to hear what we're doing around reconfiguration and redesign, both in terms of some local excellence and also the opportunities and the challenges that we've presented nationally. We've heard from Tim Briggs and Tim Evans and our own local expert in Tony Young. We had a really engaged session with all the consultants, emphasising that this is really about standardisation, access and maintaining access, and as importantly within that, hearing the patient voice.
Days of competition are over. We've now got to all collaborate if we're going to maintain timely effective care for our patients.
Innovation in the NHS is fundamental to everything we're doing at the moment. There are so many things going on, so many changes. It feels like there's so much pressure on the front line because of just clinical service delivery that there isn't time to bring on board new things and new ways of thinking and doing things. But actually we know that more of the same, but just more and more and doing things better, faster and smarter just isn't going to work. We have to do new things.
Lord Carter published a report in 2016 about improving the productivity and quality and reducing unwanted variation in the providers of the NHS. I was asked to join that team because I had developed a model called the Getting It Right First Time programme, initially in orthopaedics, to look at improving quality, reducing complications and variations, and if we did that we would see increased savings which we could then use to do further treatments.
I am tasked with looking at the productivity and deployment of our excellent clinical workforce, consultant and non-consultant doctor grades, nursing, allied health professionals and pharmacists, to see how the best teams can work together to get it right first time.
To date, we've seen improved quality and also savings of between 60 and 90 million pounds. That programme has now been rolled out across 32 specialties.
Most of the budget in the care system goes on hospital spend. So how can we join up the system? How can we work between social care, between primary care and secondary care? How can we use technology to help bridge those gaps?
Also looking at the best way we can deploy our imaging and laboratory services across sites, such as the 3 sites represented here, to provide the best possible diagnostic services to our patients.
There was an American author called William Gibson who said the future's already here, just not evenly distributed. And I think it's so true. So there are lots of examples of things going on out there where people have cracked solutions, but we just don't know about them. So we need new thinking, we need new action, and I think we've got a willing, as 3 hospitals come to start to work together, to do things in a new and a different way.
The efficiency and productivity gains that we achieve will be of benefit to the whole NHS.
We know as a consultant body we have to drive the changes locally, and I'm really encouraged by the participation today. We will need to make sure the message is spread more widely across our consultant body and our other senior clinical leaders.